Welcome back to the Psychiatry and Psychotherapy Podcast. I'm your host, Dr. David Puder. Today, I am thrilled to be joined by my Tuesday cohort, the 2025 to 2026 group of talented clinicians who spend a full year with me deepening their psychodynamic skills and reflective function. In our last episode, we explored primitive defenses. Today, we're moving into neurotic and mature defenses. Kicking us off is the compassionately discerning and quietly authoritative Dr. Jason Mallow. He is an outpatient psychiatrist and director of an outpatient psychiatric clinic at Maine Health Maine Medical Center in Portland. He is deeply passionate about psychotherapy and will be kicking us off talking about regression and then later turning against the self. Next, we will have the nuanced integrator and psychologically astute Dr. Olga Kuznetsova. She is a psychiatrist working in two academic hospitals in Boston. Originally trained in internal medicine in Russia, Olga now excels as an emergency and consultative liaison psychiatrist while also seeing patients for therapy and psychopharmacology. She's a dedicated CrossFit athlete and will be covering compartmentalization and later repression. Next up, we will have the gracefully observant and finely attuned Dr. Jeanette Ho Telling. She is a psychiatric mental health nurse practitioner in Montana who lives right by Glacier National Park. After years of medical surgical RN work, she has had a powerful journey into mental health, an avid hiker, skier, backcountry adventurer. She will be talking about isolation of affect. Then we will have the genuinely inquisitive and equanimous presence, Jason Kent, a licensed professional counselor who I would recommend in Charlottesville, Virginia. After 15 years of advertising for major brands, he transitioned into practicing psychotherapy and now works extensively with addiction and failure to launch cases. He will be presenting on intellectualization and displacement. Next, we'll have the subtly illuminating and warm Dr. Dina Golden. She is a nationally certified family and psychiatric mental health nurse practitioner and clinical professor at the Florida International University in Miami. She is the author of Fast Facts for Psychopharmacology for Nurse Practitioners, which I have a copy. Dina will be covering rationalization. Then we will hear from the courageous and compassionately discerning Dr. Katya Ronay. She's a psychiatrist with a deeply psychotherapy based practice in Washington State. Katya grew up speaking three languages and has lived in multiple countries. She's an avid skier, hiker, swimmer, dancer. She will be discussing moralization. Then we will have the sagacious and clinically luminous Dr. Natalie Dreyfus. She is a psychiatric nurse practitioner, founder of Dockside Psychiatry Clinic in Seattle. She works with adolescents and adults and also does psychotherapy and has a special interest in psycho-oncology. She brings a strong psychodynamic foundation along with somatic and holistic approaches. She will be presenting on undoing. Then we will have Chris Diadana, who is a heart-centered and authentically attuned licensed mental health counselor working in Orlando, Florida. He is deeply passionate about real life transformations he witnesses every day in therapy. He will cover reaction formation. Then Dr. Amanda Sekijima, the finely attuned and developmentally precipient child and adolescent psychiatry fellow at the University of Louisville, brings a rich background in movement, language, and cross-cultural experiences. She is presenting on identification and will close the episode with reversal. Finally, Dr. Letal Melnick, a viscerally resonant and psychologically astute psychiatrist who works in an adolescent day treatment program in New York while maintaining a private practice and teaching fellows at Columbia, will bring us a memorable Batman example when she presents Sublimation. I hope you enjoy the episode. If you leave a comment on YouTube, I will be happy to share it with the people that are presenting today. And let's start the episode. Jason Mallow, take us off with regression.
Last night, I was watching this documentary, and I just had to share this example because it really stood out to me. So it's a documentary on Mel Brooks, and,
Okay.
and uh, yeah, he once played this love doctor on a dating show, and the interviewer asked him something like when can a heterosexual woman know when it's an appropriate time to get married? And his response was something like, "Oh, when their boyfriend puts down their rattle." Regression is so it's a defense mechanism that where people seem to return to an earlier stage of development. It's definitely like a backtracking to an earlier way of coping with stress. That can be psychological and or environmental. And our psychology does develop in stages. Uh, we've all heard of Freud's oral anal phallic, and for the parents out there, we definitely know kids don't progress in a straight line. There's an ebb and flow to development, but there is a progression, and it typically with aging, this gets less dramatic.
Yeah, I've seen it with kids when they get sick, they'll regress to earlier stages, all of a sudden they'll lose abilities that they had before. Yeah, so it's normal with kids to regress. Yeah, how do adults do that? How do adults regress sometimes?
Yeah, David. Yeah, it totally happens with kids. Like, I know firsthand about like sleep regressions, but yeah, it happens with adults too, of course. And it can be natural and adaptive for adults. It's not always, pathological. And you can think of like romantic relationships where you'll hear, partners talk with each other in like baby like voices,
Mm.
like smoochy woochie, cutie pie, that sort of stuff. Or,
Everyone else cringes, right? That's not a part of that regression.
no, and yet like we do it as human beings. And like capable, well-functioning adults. I mean, you can all probably imagine someone going back to the home they grew up in and then just like suddenly becoming like infantilized by a parent, or like a little kid feeling like criticized, or
Mm,
getting into sibling rivalry, that sort of stuff.
that's good.
But then it can be maladaptive too. I'm thinking of patients throwing full-blown tantrums in the office, stomping their feet, getting in that fetal position on the floor. And Nancy McWilliams has pointed out that like somatization can be a form of regression. And it reminds me of how Freud wrote about like the ego first being like a body ego. And so like the ultimate regression may be a somatic experience
Mm-hmm.
in the body somewhere.
Yeah, that's good. Or like like finally a common pathway to dissociation, right? And just kind of, but in that, sometimes the regression, it feels like they're regressing to an earlier developmental time, right? And so we may notice that as providers, we may be curious about it. What do you do? What do you tend to do, Jason, if someone regresses in your
Oh yeah.
office?
Well, it can come in the form too of like, patients who've made strides with becoming more autonomous, or just like having healthier behaviors, self-agency, and yet like backsliding, right? And then someone's like drinking again or getting into problematic relationships again. I think the good news is that with this defense mechanism is that people typically don't lose what they've achieved. It's just
Mm,
at like where they're at right now, it's just overshadowing temporarily. And I think helping patients recognize that and become more cognizant of it and normalizing it too, um, can help support them actually having some greater control
mm,
over time.
that's good. Yeah, it's like that maybe their coping mechanisms have gotten more advanced, but then in the regression they go back to old habits. And so kind of I love your positive view on that, that you have gained the ability to jump out of that faster, maybe. Yeah, I like that.
Yeah, and it might be just like you have to temporarily be somebody that kind of holds on to their past successes until they can get to a point of recognizing it, but like you'll hold on to it for them and help them with like grounding and stuff like that to get out of it. But yeah.
That's good.
Nancy McWilliams said, if I recall, she was talking about like the very first defense that a baby has is just falling asleep. Like when
Mm,
they have stress, they fall asleep. And so, like, I'm thinking like as an adult, you could regress all the way, like you were saying, back to an early developmental stage. Like if you have like a college student has anxiety about an exam and then they study all night and then sleep through their alarm. And
Mm.
by sleeping, you're avoiding the anxiety of the test itself.
Mhm.
Yeah, that's helpful because I have patients who just lie in bed all day too. It's like they're trying to kind of regress. They're regressing somewhat. Yeah, that's good. Let's talk about compartmentalization. Olga.
Okay. So I got confused, about compartmentalization at first because there's one that is commonly known, right? And we use it sort of like in everyday life, and it almost feels like it's a good thing to compartmentalize. And so it's just kind of like a definition as an act of mentally separating different parts of your life, thoughts or identities, so they don't conflict with each other. So for example, and we all do it, like a doctor who focuses, or even a therapist, who has some personal problems at home, but he can focus on sort of like problems of their patient, and not be sort of like emotionally disturbed, maybe during the session, right? um, Another example that I had is therapist who leaves work stress at the office and is fully present with family at home, but we all kind of know that's not realistic. We all come home and kind of, we feel like we need some time, for to ourselves. Right. So yeah, it's very challenging.
We can regress to earlier stages once we get home, right? Because
And
it's a
it
safe place.
Yeah, and I think it's normal, right? Yeah. And so as a defense mechanism, it's more like the ability to keep conflicting beliefs, emotions, or behaviors separated so that they don't sort of like interact with each other. And now person is not sort of like feeling anxiety about it. And it's kind of similar to hypocrisy, which was new to me when I read, in Nancy McWilliams about it. So, for example, person who cheats in business, right? But at the same time, keeps sees himself as a very moral and kind person, right? But at the same time, kind of like do something, yeah, bad
Hmm.
on the side. And or a person who acts lovingly towards family but abuses others, and thinks it's okay,
Hmm.
so the other thing that I wanted to point out, that it's similar to splitting too, right? And so there's this tension between those two sort of like different beliefs, and it's not integrated. And I think in therapy, I don't know, I was thinking about how I would approach it. I'm sure it naturally came up during my therapy, maybe just kind of wonder, gently why person sort of like act a certain way. I don't know, maybe somebody has other suggestions on how to manage this kind of defense in therapy as well.
I see it as like largely adaptive, right? I mean, there was
Mhm.
this guy who came on my podcast talking about ordinary men, and a lot of the times he was very cognitive. And Katya, I know this is one of your favorite books.
Yes.
Um, and he was very cognitive and very emotionally distant. And
Mhm.
then there was this one part where he was talking about this early discovery. He was in Germany and he found these files and he understood what he found. And he made this connection and he starts getting very emotional. And it's like he couldn't hold that compartmentalization anymore, right? Where it was probably very adaptive for him to get to be very intellectual and separate the emotionality when he was really trying to just find the facts and the details of this horrendous thing, right? So it'd be totally overwhelming to like fully grapple what that was like for
Mhm.
the Jewish people to be murdered as they were by the German military officers. So, yeah, compartmentalization can be very adaptive. And so if it's happening for good reason.
I think about compartmentalization too, Olga. I like how you separated it with like this the tool that we use. And I remember working as a nurse on the floor during COVID. And, walking into a patient's room and I distinctly remember, this older gentleman, and there were two patients on my panel, and both of them were COVID positive. One of them was not doing well at all, tanking. And it was when visitors also couldn't be in the hospital. And so holding that space for this patient in the distress and then walking outside the room, kind of gathering myself together. And then I go into the next room where this other patient is also COVID positive, not showing any symptoms, pretty happy go lucky. He's able to talk to his family. And I think it was when I was reading about this, I'm like, oh, okay, that makes a lot more sense to me, in that I needed that tool to be able to do that work and like be present.
Mhm. Yeah, and I have talking about regression and kind of mixing these two together. I don't know if y'all have ever had this experience where you feel sick, maybe you have like a stuffy nose, a little virus, and it's harder to compartmentalize, right? So I'm with the patient, and instead of normally I can compartmentalize, I can be fully present with that person. Now it's like other stuff from previous patients is leaking in, stuff from my home life is leaking in, and it's like a little bit harder to control the affect that I made, the second arrow of critique towards those things creeping in. Yeah. So,
Yeah, I have that happened when I switch from one patient to the other. Sometimes it's really hard, when there's something
oh
stressful
yeah.
has happened, you can't really get back to yourself and put it away right away. And so sometimes it takes time to kind of like, yeah, that's interesting way of, yes,
Yeah.
I seen that happen. Yeah.
I was thinking about the idea of like integration, like helping someone be able to handle integration more and more. And specifically, the example that came to mind was like helping someone who's an addict who is part of a spiritual community, where they keep those two parts of their lives completely removed. But I've seen like real change happen when you're able to help that person get to the point where they can find a safe person to share this other part of their life. And when that integration happens, I think there's a strength that comes with that starts to heal some of like the maladaptive parts.
Hmm.
Mhm.
Yeah. Reduces the shame, right? That person is holding too. If someone can hold that part of them. Yeah. Okay, let's go to turning against the self. Turning against the self. Jason Malo, you're up again.
Yeah, this one's me again. You've got me again. Yeah, turning against the self. So this one describes a unique kind of displacement where an individual becomes their own substitute target of for negative emotions about another person. And it's like what the ego does is it literally like reverses direction of things. It does a 180 of external, blame to self-blame. And it can present itself in so many different ways. Self-criticism, self-harm, feelings of real shame, feeling fundamentally flawed.
Knowing this, right, as a therapist, for you, Jason, as a psychiatrist, knowing this, has it helped you become conscious of it when you do it towards yourself? Like, have any of you caught yourself doing this now that you're conscious of it?
Oh yeah, I think so. And sometimes it will, I'll catch it after the fact. It's really nice when you catch it when it's happening, but I'll find myself so maybe flustered or frustrated by a patient I'm working with. And for those of us and all of us who work with patients who have severe mental illness, it's inevitable. Like we're gonna have strong feelings about them. And so anyway, it's just ironic when that comes up, and I'll find myself like going out of my way to like maybe help a patient or call them or spend extra time with them or something like that. And it's like, wait, what am I doing? Like I was so frustrated and angry, and where did that go? And what did I turn this into? And now I'm meeting with this patient 3 times this week. And um, but yeah, when you catch it, it's super nice. And I think being in a place where like we have good supervisors or maybe colleagues we can trust in, or maybe David, we're part of group supervision, like your group supervisions, where you can process some of that stuff. I think it helps you get ahead of it.
Yeah. It's really painful, right? When you take that anger, maybe the injustice, and you point it at yourself, right? It's like, yeah, it can be very uncomfortable. Okay, what would we say to a patient who we see them maybe take some anger and point it at themselves?
Um, I think one tactic here could be something like getting your patient to just try to get their observing ego online and think about like somebody else in a similar scenario. Like think about a friend of yours or a family member of yours who they're in the same exact scenario that you're in. How how might how might they respond to it? How might you feel about them? What would you have compassion for them? Would you critique them as harshly? An example could be something like you've got this patient who maybe they've got a boss who's super critical of them, but then they find themselves being really critical of themselves and feeling like I need to work harder. I'm like I'm not doing enough. I gotta step it up. And then they're offered maybe promotions or something and they give credit to somebody else and you're seeing this happening. I think you could ask them to reflect on imagining somebody in the same scenario that's not them, and what would you advise them to do, or
Hmm.
imagine how you'd feel for them. And
Yeah, that's great. I love that.
I've also found that the turning against the self sometimes functions in trauma survivors who have experienced a great deal of powerlessness. And if they make it about them, it creates the illusion that if it's about them, then there might be something they can do or something they can fix. And so it sort of attenuates that feeling of powerlessness.
Which is tricky because if you're the provider and you
Mm.
try to take away this defense too quickly, it can make them feel powerless, which and dissociate even more.
Right, right.
Mm, yep. Like I'm the perpetrator. It could also be like anger, guilt towards themselves for being
Mm.
putting themselves in this situation, not speaking up, not telling the person to stop more. It also could be blaming themselves for future stuff. So like I've had patients who say like every time I masturbate, I am abusing myself. So they're continually turning against themselves with what would be like a normal thing. So from the trauma. So it's a trauma-based perpetuation. So okay. Shall we shall we keep going with Olga?
Repression, yeah. Yeah, so repression is unconscious blocking of distressing thoughts, memories, impulses, so they don't enter consciousness. And unlike suppression, which is conscious, repression is automatic. Outside awareness happens kind of very quickly. And the other thing is that the person is not choosing to forget something again. It again happens automatically. And I want to talk about example repressed anger toward a parent. And I see it all the time in therapy. And I don't know if that's related to repression or maybe something else is involved here as well. I'm sure. But when a patient says that they have a perfect childhood and describe like parent as wonderful, and yet sort of like maybe a little bit of sort of like story to it, and then the patient has some symptoms, could be some somatic symptoms, headaches, or it could be some sort of like anxiety, irritability with authority figures, right?
Mhm.
So that anger could be repressed, and it's really, I guess frightening to the patient to imagine that their parent is not perfect, right? So maybe there's also some regression linked here. So yeah, that kind of like interesting example. So but the emotion will still leak out, right? Whatever is repressed, it's going to find its way out, but it's not going to be that sort of like obvious, right? I think that our job as therapists just try to link it.
Yes. So Repression, in your example, the person is repressing any negative feelings towards their parent. They're unconsciously pushing them down. It happens automatically outside of awareness. As McWilliams notes, something must first register at some level before it is consigned to unconsciousness. Denial is the more primitive form, where memory or reality doesn't even come to the surface at all. Denial is more of a wholesale refusal to acknowledge something. Repression is different. Something may register briefly. A fleeting thought or feeling is distressing, but it gets automatically barred from consciousness. That is what gives repression its neurotic level quality. It's more sophisticated than denial, but it keeps the material out of awareness, often leading to indirect leakage. In your example, it's great because the adolescent or the adult is having some passive aggressive anger come out towards authority figures, maybe even towards you, Olga. I can see that sometimes as a compliment because you are the safest person in the room, the one whom they can begin to allow the repressed material to surface in the transference. That's often where the real therapeutic work begins.
Yeah, and I think, maybe part of why they are not comfortable expressing the anger towards parent because they're anticipating the parent is going to react a certain way, that will be distressing to them. And I think your job as a therapist is to kind of like be neutral and contain the anger, right?
Mm-hmm.
So yeah.
Yeah. What about with grief?
Right.
Um,
Yeah,
Mm.
the
how can
grief.
repression be a part of grief?
Yeah, that after losing a loved one, someone reports feeling completely fine, everything is okay, and shows no sadness. And months later, they develop depression or unexplained fatigue, for example.
Mm-hmm.
I just had a patient today, actually, in therapy that lost his best friend to cancer when he was 8. And when he got the news, his mom actually told him it was his mom, my patient, and his sister who barely knew that person who passed. And so when she told him that she passed, both mom and the sister, they burst out in tears. And he says, I didn't cry. I couldn't express any kind of emotion. And I didn't expect her to die so suddenly. Right. And so years later, what we've been working in therapy, he has trouble being there for someone who's grieving. His girlfriend recently lost her cat, and she was, had extreme sadness. She was crying. And he said, I was really uncomfortable sitting next to her, while she was crying, and I wasn't sure what I could do. And I really wanted her to stop. And I'm not in a mean way or anything. I just didn't know what to do with it, you know.
Mm-hmm.
Um, so, and we kind of like went back to that, when he was 8, and I think he sort of like dissociate from that, repress the grief and kind of like didn't learn how to maybe grieve in his own way, right? So we worked around that. I think it was interesting, how he repressed it throughout his life, and it still kept coming out, in a way of this weird feeling that he was experiencing when somebody was grieving.
Yeah,
Uh,
yeah, yeah. Somebody else is grieving. I'm feeling anxious. I want to
yes,
repress their emotions too.
yes. Mm-hmm,
And
mm-hmm,
you'll see parents who maybe don't have as much insight as your patient. They'll say
mm-hmm.
things like, stop crying, don't
Right.
cry.
Mm-hmm.
You don't need to cry. You're done crying. You know, don't be angry.
Right. But if
Like,
you're not crying, it's also strange. So it has to be like a norm, you know what I mean? Like if the kid is not crying when it's supposed to cry, something sad happens, that also is, parents are worried.
yeah,
Yeah. So
There was a time when I was repressing some sadness and grief, and luckily I had a therapist who was really helpful, just giving me space, right? But there were also other relationships I was in where I felt like people wanted me to feel, and there was like a pressure
Mm.
in that. And
mhm,
one of the things I found helpful with working with repressed sadness, repressed grief is sometimes I'll just tell people, like, there is no pressure to cry here. You don't have to cry. I don't think any differently of you. I would just love for whatever comes up to let it come up. And I found that to be really helpful, like in my own life, but also for clients to let them know, like, I'm not looking for a specific response.
I
Like
like that.
repression makes sense in your story. So let's just let whatever comes up come up. And if it's tears, it's tears. If it's not, then fine.
In our session today, actually, tears come up, and a couple of times he couldn't really speak, because of, yeah. But I like your, approach to, yeah, it's
Yeah.
helpful.
I think it's like whatever they're feeling shame for, if you can lessen the shame somehow. So it could be dissociation. I feel guilty that I feel so numb and I don't feel anything. It's like I want to be with you in the numbness. It's okay to be where you're at. There's good reason for why you're feeling this. Let's be curious about it. Let's try to understand it. Let's see if we could put more words to it, right? So let's see if anything, other thoughts on other images come up. But yeah, I think the key point is like people are feeling what they're feeling. They're having these defenses for various reasons, probably reasons that we don't fully understand. If we fully understood, maybe we would have more compassion. Maybe they would have more compassion for themselves.
Mhm.
Let's go on to the next one. Isolation of affect, Jeanette.
Right. I actually think this is kind of a cool one. Isolation of affect is just what the word says. Basically, it isolates feeling from knowing. In other words, it operates by altering internal processing and associative functions so that thoughts are accessible. You can see what's going on, you can reason it through, you can make good decisions, you can still function, but the emotional significance of what's going on is actually blocked. And so you might observe someone that the content of their speech might be emotionally significant, but that isn't coming through, like the emotion is absent or incongruent with what they're actually talking about. It's a super useful adaptive function for anybody that needs to be able to maintain competence in the face of really overwhelming situations that would otherwise be disabling. You know, medical professionals, I think we've probably all experienced that we needed to use this defense in order to stay competent and coherent with our patients without being overwhelmed by what we're actually seeing or hearing or being involved in. First responders use it a lot. Combat military members definitely use that a lot in order to stay competent without being overwhelmed. And so it can be hugely adaptive and functional, but when it becomes maladaptive is when it becomes rigid or pervasive or chronic. And you're out of the crisis and you can't shift out of that. You can't start then feeling the emotional significance or, processing that. It can show up then in trauma contexts where emotional numbing is one of the main symptoms of PTSD. And so isolation of affect can lead to that, where people just can't feel what they feel or, feel what it was like to experience it. At the more extreme level, it can contribute to dissociation. It's also in terms of personality style or personality disorder, it tends to show up with the obsessive personalities, where they've done some studies that show that people with OCPD have an attenuated access to their emotional states, and they might be able to reason about them, but they can't actually experience it. And so, there's the benefit that people are protected from emotional flooding, but it can be at the cost of feeling alive and being able to actually participate and experience, life and liveliness. Um, I, as an example, I have a patient that I see on a weekly basis, 50-year-old guy who went through just really extreme domestic violence when he was a kid. And he watched his dad break his mom's arm, and he stepped into the role of protector And his mom would always side with his dad anyway. And just a lot of horrific stories like that. And as he talks about it, he can describe how terrible he feels, but he doesn't actually feel it. It's like it's very mechanical in how he talks about it, very rote, um, somewhat pressured, but the affect there, being able to feel the grief, the fear, the loss, the betrayal, all of that, he can't access that. It's very hard for him even to, to taste his food or see colors when he walks outside, a sunset or a sunrise. Um, to be able to just enjoy a sensory experience or an experience of relational pleasure. And so, yeah, it has come at a great cost to him.
Hmm. Yeah, really, really articulate. Thank you. Thank you for sharing the story and the details on isolation of affect. Yeah, and does this bring up any other thoughts for anyone else?
I just wondered, are you all aware that you use that when you're sitting with patients who are telling difficult stories?
Yeah, definitely. Yeah, I mean, sometimes I guess, so it becomes such a habit now, so I don't think I'm sort of like aware of it, and just it happens. I was going to ask you, so you're saying that this patient could not taste food, enjoy sort of like it outside, certain things. Is it because it kind of spread, that isolation of affect, and it,
He's
yeah,
Yeah, it seems like he's kind of globalized it.
right.
And I think it's contributed to some alexithymia for him. Also, um, it probably, connects with anhedonia somewhere too. But yeah, for him to experience feeling or of emotion or even sensory experiences like has become threatening to him,
Yeah,
or and he's forgotten how to do it. So
he's
that's
more.
something we work on,
Yeah, it sounds like almost like a dissociation. I mean, it's dissociative to dissociate away from your emotions. It's also very adaptive. The memory that came to me was when I went to Haiti as a medical student between my first and second year. I followed an orthopedic surgeon, and within 1 week we did like 50 surgeries, and I remember just feeling very like robotic towards the end. I mean, no painkillers in Haiti. The wards are all open, so the beds are like 2 feet from each other. It's a very different experience than in the U.S. And I came back and I had video that I shot. I shot video the whole time, so I had like 8 hours of video, and I spent a lot of time going through the video, and I felt emotions in a way that I wasn't able to feel it then. And I think this is like that was therapy for me to go back through the video and edit, make a documentary or a little mini documentary. And
That's a great example.
it really helped me kind of come to more of the emotional experience, try to evoke the emotions in other people watching the video, maybe that were hard for me to even feel. Yeah, I think that it can be very adaptive as a first responder, right?
Mhm.
To be able
Mhm.
to claim down. I saw this a lot in COVID, in like nurses that worked in COVID units.
Mhm.
It's like in health professionals, and there was a connectedness between first responders as well that I saw, like because of the harshness of the conditions at times, and you know, there was a shortage because a lot of people were sick, and there was an unknown of how deadly it was when it first came out, right? And a lot of fear. So yeah, I think these are examples of like it can be very adaptive to isolate the affect.
It's so interesting too, David, I mean, when you were saying that with your experience from being able to, I've never been able to conceptualize it until you were talking about it with kind of then feeling these emotions after watching the experience that you had with the surgeries. When I was in working within like psycho-oncology, we'd work with patients going through treatment like chemotherapy and or transplant and things like that. And they were not able to verbalize what was happening. Or they could not even, they wouldn't work with a psychologist on our staff because they were not in the mental space to be able to do that. But we got a lot of referrals to our team after treatment was completed, when they have gone into remission or when they have completed their treatment courses or gone through transplant, because then now they're able to really focus, and now they're feeling all of these overwhelming emotions of grief and overwhelm and distress when they were so kind of hyper aroused in this state during their treatment.
Yeah.
I was going to say that as a therapist, I think it's important to really pay attention with how contagious the isolation of affect can be, because it's very easy to dissociate with people like this, right? They're so separated from their emotions, and they might even talk about emotions, but in a really flat way that feels, as a therapist, it feels really very boring and deadening. And so it can be a challenge to just stay awake and alive and to really actually encourage the feelings and not just sort of this distant talking about what happened
Yeah.
Right.
without actually feeling.
Yes.
Katia, I was just you just reminded me of clinically how this can come up where we're working with relationships or couples, and this feeds into a gender stereotype, but like where one of the partners could be more of a fixer or doer and the other one more emotional, and really trying to give some education or encourage each of the people in the relationship to see the other person's point of view. I think it comes up in relationships where one could be um holding, not being more of the I'm gonna stuff these emotions, and the other being I'm gonna take action here.
Right. The pursuer withdrawer dyad, like the pursuer is putting the emotions right out. The withdrawer says, if I share these emotions that I'm having, it may be dangerous to the relationship. I'm going to hold these in. And the pursuer hears that as like they're lonely, they feel disconnected, they don't know where their partner's at, and the partner gets the message, I'm doing it wrong. And then they get in this dance, and the dance becomes the attachment dysphoria. So, okay, let's keep moving so we can get through get through half of this. Intellectualization, Jason,
All right.
Kent.
So intellectualization involves retreating into abstract thinking, analysis, theorizing to avoid the experience of the emotional weight of a situation. So the person thinks about feelings rather than feeling them. Think of that as like a left brain fortress against emotional right brain experiences. Um, Nancy states that intellectualization is like a higher order version of what we just talked about. So the isolation of affect. So the difference being a person using isolation of affect typically kind of just reports no feelings, while the intellectualizer talks about feelings in a way that just kind of strikes us as emotionless, like kind of like reading a weather report.
Yeah, or they could just move into the theory of emotion, right?
Right,
Like,
right.
let me tell you about the micro expression that I just might have flashed on my face.
Yeah, I mean, an example of trying to engage in an emotional experience of someone with grief, and they were like, well, I know there's 5 stages, and I think makes sense that I'd be in the depression stage right now, sort of just like in this detached way.
Or there's 5 stages of grief according to the first theory, but I actually prefer the new theory where there's actually 7 stages. And let me tell you why I think that's actually more advanced.
Sometimes as a therapist, for me at least, it gets like I get kind of allured to like I get like drawn into their, intellectualization sometimes, and you want to like banter with them, but uh,
You okay, so yeah, it could be a distraction.
right, right.
It's a wonderful way of avoidance for the anxiety of feeling, right? Yeah.
Probably common with obsessive compulsive or high functioning depressive personalities. It's like a really good, allows, if like a CEO, right, it allows goal progress in the face of sort of emotional weight or like public opinion. It's adaptive as long as the feeling's postponed, not eliminated. But obviously, it's maladaptive, and it like, you feel like a lack of connection with these people. Like,
People that go on dates with someone that's a heavy intellectualizer may say like he was very smart, he's very articulate, but I didn't feel a connection. I don't even know a sense of who this person is really. Um, Latal, what are you thinking?
I was thinking that's a really nice example of actually a defense, right? This guy is so smart, but he's defended and it's protecting himself, but it's actually totally a barrier. So I love your example in that way. It is a defense. You're trying to protect yourself from an experience and what you're actually feeling, but in your protecting, you're hurting yourself.
Would this be considered intellectualization? So I had a therapy patient that was stage 4 cancer. So we talked a lot about death, dying. And he was talking about who he wanted to make decisions for him in the end. And he ranked family members like, okay, well, I will say my son first because he's in the army and he's seen a lot of things, like he's seen combat, and so he knows death. And then number two, so my wife because she knows me well. Number three, my daughter because she's a social worker, so she knows these sorts of things. And gave, gave a weatherman report on analysis on family.
It does sound like intellectualization, yeah. And not all intellectualization is bad. I mean, he may be making a good decision based on that. It's like sometimes you have to have that like intellectual process and then like, well, what does your like gut say, right? What do your emotions say? Um, so it's like a mixture of the mind, right? Cognitive process and the emotional mind, wise mind.
It feels really close to that isolation of affect. Feels really, really similar.
Yeah, it does, doesn't it?
Is it a matter of degree that makes the difference, or?
This is where I think the affect is missing in the isolation of affect. In the intellectualization, it's more of what they're doing. They're developing theories and ideas around the emotions, or to even take themselves further from the emotions. So, in one of our groups, Latal was giving examples of emotions in like game theory and stuff like that. And I was thinking about it afterwards, and I was like, well, this is not intellectualization because it's a way of trying to communicate her emotional experience, right? So I feel like intellectualization actually moves people further from understanding your experience of emotions because it's so heavily intellectualized. A lot of philosophy that's like very dry, or it's very like it's like people who have it's like if they have strong erotic drives, the intellectualization of eroticism might not be anything erotic, you know. It could take them further away, whereas sublimation would take them into maybe dancing or doing something, you know, that resembles erotic. But the intellectualization, I feel like, can get someone further distant. So that's the way I understand it.
Even reading, deep psychodynamic texts, right? Psychoanalytic literature, you might be thinking about really interesting and intellectual, even philosophical ideas that are actually quite far removed from the emotions.
Absolutely. Especially if people are talking about like, oh yeah, this is the Oedipal triad. And it has nothing to do with the Oedipal triad. It has nothing to do with like, but it's sometimes the big words almost distract, right? Or it's like the reaction formation and the egosyntonic feelings of this person, or, and when I listen to all of those words compiled together, it's like, I don't even understand. And I've like read a lot of this stuff. So it's like, do they understand? You know? And if they don't understand, then is it a way of detaching from the distress?
Maybe they understand, but they don't feel it.
maybe, yeah, there you go.
That's the whole defense, right?
Yeah.
Thinking equals safety, you know.
Mm.
I'm thinking about those patients who come in and use medical jargon or the DSM lingo. And
Mm.
someone was in my office the other day, like telling me all about like I was manic, and I kept on coming back to this, like just take me through more details here. Where were you? Like I just need more context here, and I worry like yeah, jargon can be or diagnostic jargon can be picked up and used this way,
Mhm.
like intellectually.
Yeah, and I could intellectualize using the very words that we're talking about today to disconnect from the emotional experience, Like if I was to use this, oh, what you're doing right here, Jason, is you're intellectualizing. And that's really what's going on.
Is that a regressive voice, David?
Yeah.
This is my regression into nerddom when I was when I was not an athlete and I avoided PE.
All right, those nerds are coming back when they're lawyers, you know.
You got me, Latal, you got me blushing here. Oh my gosh. I'm like, oh, I feel like what that felt like. Fifth and sixth grade, awkwardness. Okay. Dina, let's talk about rationalization.
Okay, so rationalization is essentially a cognitive distortion where someone would reframe their actions or thoughts to protect themselves from painful realities or unconscious conflict. So the the motive or feeling is unconscious, but the person creates a conscious, socially acceptable, logical explanation to make themselves feel better or to protect themselves. And it's used for protection from an unacceptable maybe impulse or cognitive dissonance, internal conflict, to deflect responsibility for actions or outcomes, and also for someone experiencing anxiety or shame. So there's a few different ways that rationalization works. So for the one of them is it's known as sour grapes, right? So that's when a person devalues what they can't have or can't achieve. So they'll say something like, "I didn't want that promotion anyway," or if they wanted, let's just say, a house that they didn't get, they would say, or they couldn't afford, they would say, well, that house is too big for us anyway. And the sour grapes comes from Aesop's fable that where the fox was like reaching for the grapes and wasn't able to get the sweet grapes. So the fox just says like, I don't want them anyway, right? So that's just an example of one way of using rationalization. Another is known as sweet lemons. And this is where it's a kind of self-deception where a person, like to obtain comfort and accept reality, they use a more optimistic approach, right? So that's when something bad happens, and then something bad will happen, and then they'll make it okay. So for example, something bad happens and they'll respond like, well, that was a learning, that was a learning experience. Or if they have a breakup in a romantic relationship, they'll say that breakup was great. I didn't really like that person very much anyway, or we were very different, something like that. Rationalization also can be used to justify a behavior, or to put meaning to a behavior. So it can be good or bad. So oftentimes someone won't be able to maybe justify doing something good, right, for themselves, or unless they give themselves good reason to do it, or they can do something not good. Like, for example, a parent that hits a child and has a lot of aggression and says, well, it's good for the child, what I'm doing. Or let me think what else. Oh, they can eat junk food, for example, and say, oh, life is short. I deserve to enjoy what I'm eating. So they'll justify what they're doing. as far as a defense, it's considered more mature because although it's unconscious, it does involve some contact with reality and logic and reasoning, and also to understand like what's socially acceptable. They have to have some insight to do that. As far as clinically, it can be a way of not can be used to not take responsibility. Let's just say a client that misses appointments or is resistant during sessions, it's sometimes defensiveness, so that they don't ever have to really explore the core issue. It can impact, trust. And then also, it's very important as the clinician to not, if you start to use the rationalization, it can also not help the patient because it's like they're not going to get to where they need to go and what they're trying to, the internal root issue. So it's important as the clinician to maybe notice patterns and bring that up, or to, explore the underlying conflict or something like that, if that should happen. So the defense can operate benignly when it allows someone to make the best of a difficult situation. But the drawback is that it's a defense strategy that virtually anything can be and has been rationalized. So it's good and bad, like the sweet and the sour. So that's
Too much and too little.
It's a lot. It's a lot.
The soup is too hot or too cold.
Right.
Yeah.
Yeah, and I great job, by the way. Great job going through that. Really like how you separated that with the Aesop's fables and stuff. That's good. And you could see how someone would be pulled into this. You could see how like we all are. We all rationalize. I was even thinking the you know, with the breakup thing of like, oh, it was a learning experience. It's like, yeah, I mean, maybe it was. And maybe that's worth emphasizing, thinking about what are the things that have been learned from it. Or after like a kid's sporting thing, after one of my kids' sporting thing is like they lost and they're disappointed. It's like, well, okay, here's the things that went well, and here's like, takes time to get better, and so we're gonna work on this, and we're gonna work on this, and like I don't know, is that a rationalization? Maybe that's not quite a rationalization. Or
Well,
maybe if the rationalization would be lessening the blow of the loss, instead of like sitting in my kid's disappointment, it would be like, no, this was great. You learned so much.
yeah, that would be rational. Yeah, it was a learning experience. Like you can, even though you feel bad, you lost, it was a learning experience.
I've heard sometimes someone will say to someone after a really bad breakup, like, "Well, dude, you dodged a bullet, count yourself lucky." Seems like a little bit of the sour grapes.
But maybe they did dodge a bullet.
Right, maybe they did.
Maybe they did.
It might be
So,
true.
yeah. Yeah. Well, I think the point is to not have it repress the feelings, right? So it isn't that it's a problem to have to use one's intellect, right, to make sense of it or to make the best of a bad situation. But the problem is if you're trying to fast forward the feeling, right, the disappointment, the pain, the hurt, the tears, all of that, and then jump straight to, oh, don't worry about it. You dodge a bullet, right?
That's
Mhm.
great. I was rationalizing the rationalizing, and Katya just cut it to the
I
core
cut
of
it.
like
I cut you down.
Good
she
job, Katya.
she
Thank you. Thank you.
she went straight into the higher reflective function position of like, no, you gotta like sit with the grief. You gotta sit with the emotion.
I thought Nancy McWilliams, she gave a really good example in her book where a therapist is insensitive and raises a patient's fee and then rationalizes the greed by deciding that by paying more, it'll benefit the patient's self-esteem.
Yeah.
Well,
Go ahead.
Dina, I was also thinking about how I'm going to be talking about moralization, and it's a really specific kind of rationalization. You touched on some of the of the issues where it could be a sort of a moral issue like, oh, well, actually, this is going to be good for the patient, right? When actually, you just want to raise your fee.
Right. Or like if you're morally corrupt, you then would rationalize.
Why
Mhm.
don't, because they're so similar, Katya, why don't you go through moralization now?
Sure, I'd be happy to. Yeah, we've warmed up, and it really is a very specific type of rationalization. So there's quite a lot of overlap. It really, the point of it, well, like a lot of unconscious processes, are to protect from painful feelings like shame, of behaving in a way that's hurtful to or selfish, and to maintain a narrative that one is not a villain. So a benign example would be similar to what Dina was saying, like. Um, I steal my roommate's leftover birthday cake, and I'm like, oh, it's for his own good. He's on a diet. He didn't really want to eat it. It's for his own good. So, this sort of relieves a little mild guilt. It justifies a little misconduct, but it's all fine. But then there's really much more traumatizing ways of using this moralization defense. And so jumping straight from the benign a little funny is, it's a really typical example of justifying sexual assault. And so from a perpetrator's perspective, the unconscious moralization would be, this would be the stance. It would be something like saying, well, this is socially acceptable. So, for instance, a man feels entitled to claim that a behavior, a sexual assault, is normal or ordinary or understandable because, for example, I paid for a date. We went out for dinner. Of course, I'm entitled to to have sex, or the shifting blame to the victim. That's another type of way of moralizing one's behavior and saying, well, she clearly invited it, she participated, she actually wanted it. It's almost like it's for her own good. I mean, she was wearing what she was, provocative clothes. I just did what she wanted to. Almost like justifying to himself, and I'm using himself, but because that's usually what happens, justifying that it's almost a favor. Or another type of moralization is to say, well, I is to not have a malignant intent. And so saying, well, things got carried away, but I didn't mean to hurt her. I, I thought she was into it. The other really big one is a moralization by saying, well, everybody does it, right? A groupthink type of mentality. And so for a pedophile to say, well, it's normal for grown men to like younger women or even underage girls. And so to justify that, or horribly in wartime sexual assault, it's, that type of behavior is so pervasive that it can be explained away. So the treatment for that type of moralization behavior, whether it's more benign, you can kind of let it go and have a laugh. But if it's more severe, you have to really try to get to to the shame and to address some of these ways of splitting off, well, a lot of emotion, but also the splitting of good and bad, which is a part of moralization, um, and to really shine a light on the shame, and then ideally to to understand and accept it so that amends can be made, some type of amend.
Yeah. I was thinking about the pedophilia one. We did an episode on this with Cummings a while back, another episode with some forensic guys. Some of the beliefs that they have is like, the kids enjoy sex, kids are sexual creatures. It's a form, kids want to connect through sex, and it's like these cognitive lies, these moralization lies, allow them to maybe exculpate their own guilt, right?
Mhm.
And so it's like, no, that is not reality. Like that is a lie, and guilt is actually teaching you something, right, about your values, and that you don't really value doing that. And so the guilt is underneath the guilt is sometimes hidden. And sometimes people turn to alcohol or drugs or heavy benzo use or heavy sleeping medications to deal with the guilt so that they can cope with the guilt. And it doesn't really quite ever leave them. So they have to numb it somehow. So something I've been thinking about. So moralization. Any of you guys, anyone else have any thoughts come through your mind as Katya wonderfully goes through moralization?
I don't think this really adds to the discussion much, but I just think of the physically abusing kids. One thing I've come across, heard of is people defending it by saying like, "Oh, I'm teaching this kid how to fight for themselves and to be stronger." It's building their strength.
Yeah, there's no data to support that, unfortunately, you know. So
Yeah.
unfortunately for that person that's lying to themselves with that moralization. Or they'll use like some spiritual verses to support their, actions or whatnot, but they're cherry picking, whatever spiritual discipline that they're going through. So yeah, I've had debates with people who believe like it's the best parenting method to spank your kids, and I've debated them and said the data doesn't really show that. That's not actually like the best way of doing it. Like corporal punishment doesn't really work.
Or sometimes they'll use it they'll shame somebody, right? They'll shame someone, and then let's just say what they're eating or something like, oh, I'm doing it because I'm helping that, I'm helping them with eating healthy, but like if something comes out and it doesn't go well, and then they'll
Yeah,
use.
no, actually studies show if you shame an alcoholic, they drink more alcohol. They don't drink less alcohol, right? If you shame someone with shame doesn't move people towards mental health.
Mm-mm. No, but I'm saying the person like that would do that, they can use moralization to justify like what they just did.
Absolutely. Yeah, I know. I'm,
That's what
I'm
I'm
agreeing with you.
saying.
I'm
Yeah.
agreeing with you. I know you're not validating that method.
Yeah, no,
I'm
no.
when I was reading about motivational interviewing, I read that they did this study about like shame-based alcohol reduction and actually drove people to further drink.
Yeah.
And yeah, it doesn't work. It's like if you're depressed, I could shame you out of your depression. No, that's not going to work. That's actually going to push someone further into the depression, probably. So moralization, that's good. Okay. Natalie Dreyfus, can you tell us about undoing?
Yes. So, undoing is a defense mechanism where a person performs behaviors or mental acts to symbolically negate, reverse, or undo a previous thought, feeling, or action that led to some affect. Usually, this is anxiety, guilt, or shame. Undoing primarily affects observable behavior rather than internal perceptions, making it distinct from something like reaction formation, in that undoing is performing an external action after the fact to magically erase what happened, trying to cancel out this feeling, versus reaction formation, which attempts to transform feelings internally, trying to mask the feeling. So I like this example because it just really simply put this. When we think about undoing, it can be thinking about trying to unsend a text message, except the person believes that if they perform the right ritual, they can take back not just the message, but the thought or feeling behind it. Undoing exists on a spectrum. So it is a normal human experience, but it can be problematic when it becomes rigid, time consuming, or causes distress. And we see it, and it's most clinically relevant in things like obsessive compulsive disorder and borderline personality disorder. Treatment like psychotherapy can help develop more flexible, adaptive ways of managing anxiety. And the goal in treatment isn't to eliminate the defense, because again, this is a normal human experience, but rather shift it towards more mature ones like suppression or humor.
So reverse, cancel out, neutralize a disturbing thought, impulse, feeling, or action that causes guilt, anxiety, or shame. Anyone have like an example that comes to their mind of this
Yeah.
in BPD? Or go ahead.
Oh, sorry. I had an example. I thought it was in a Nancy McWilliams book or maybe somewhere else. The husband sort of cheating on his wife or flirting with someone coming home and kind of showering her with, love and care and sort of like, yeah, is that?
Okay, or yeah, so maybe it could be a lot simpler. It could be like they have like some attraction to some other person, right? That feels
Hmm.
overwhelming, and then they come home and to undo it, they to cancel it out, to reverse it, to neutralize it, they do this kind of behavior towards their wife, maybe bring her flowers
Right.
or some ritual.
Yep, Olga, it was like this. They had the conflict the night before, and
Oh,
then the
that's right.
husband, the
Okay.
spouse was
Mhm.
coming back and giving the wife flowers, trying to undo this conflict or feeling guilty for having this big altercation.
Hmm. Hmm.
Okay, like how about in OCD?
Undoing is the actual compulsion. So it's that compulsion, the ritualistic behavior that temporarily relieves obsessional anxiety. And so thinking about OCD, there can be like a 45-year-old accountant who has fear of contamination. It's a common one. But after touching a doorknob, the patient washes his hands in specific sequence. So he will apply soap 3 times, water temperature is adjusted to lukewarm. He rubs his hands together for 30 seconds and then dries his hands with exactly 4 paper towels. Now, if any of these steps feel wrong, the entire sequence must be repeated. And the washing ritual, so it's unrelated to the actual hygiene of washing his hands. It's the washing ritual is undoing the fear of contamination and that anxiety around contamination.
So someone with like a pure OCD, primarily obsessional, may feel the need to mentally, behaviorally reset their day after they've had some sort of bad thought that's contaminated it. So they may do this by repeating prayers, mentally erasing the thought, starting routines from the beginning to achieve a clean state. So that's another example.
That would be also considered undoing, right? Because it's not just because it's not externally
Right. Yeah. I
a
think that's,
behavior. Okay.
I think so. Okay. Undoing the behavior. Maybe the behavior in that case would be the prayer, the
The
kind of
mental
like
ritual.
mental ritual, right?
Hmm.
Okay. Jason Kent, let's talk about displacement.
Right. So displacement's the defense in which a feeling of impulse, drive, or behavior is redirected from its original target to a safer or less threatening substitute. So it's kind of an unconsciously saying, I can't direct this feeling here, so I'm going to direct it there. Um, and why do we do that? Why it's sort of a like directing the emotion towards the original target would produce anxiety or fear, potentially of retaliation or abandonment. Maybe like you might have anger towards a parent, but it might not feel safe. Um, or guilt for being angry at someone you love, um, or perhaps some helplessness. So a classic example, which Nancy puts in there too, is the individual has a bad day at work, is yelled at by his boss, goes home and yells at his spouse, who turns in turn scolds the kids, who kick the dog, and the dog takes it out on a toy. Um, just constant displacement down the line. But maybe a more appropriate example for therapy, um, maybe someone's processing or experiencing a great deal of grief, but they've targeted the hospital or the doctor or the healthcare system. Um, Nancy points out to the maybe when there's been a infidelity in a relationship, the betrayed partner will direct the anger at the other person instead of the unfaithful partner.
Mm.
And then the family, she mentions but when family systems, the idea of the triangulation, so maybe the tension between parents gets just shifted to a third, the child, which of course happens quite a bit. And then there's the sexual displacement, or like this sometimes the fetish of like a fixation on feet is a redirected erotic interest from the genitals that might have evoked anxiety from historical fears of castration, or maybe a parent like made that part of their body fearful.
Is scapegoating apply here? I could see how it would. The way you're describing it, Jason, that like, when people are unhappy with whatever life circumstances, pick out the faulty party and blame that. I could think like on an individual level or even like societal, like oh yeah, like things are really bad. If we just took care of this group of people, like everything would be better.
Right, right. It's like a very safe target, right? It's not, you don't have to, there's no consequences there.
I think that would fit because you're displacing a feeling, impulse, drive, or behavior from the original target to a safer or less threatening substitute, right?
Mhm.
So the scapegoat is the goat. The goat is takes the blame rather than the person for their wrongdoing, right? So yeah, I think that would work.
It can show up too, like just in a session where maybe someone's maybe a client's actually kind of angry with you, but they're not sharing that. They're pointing out their anger at like all these other people.
Or they could be
Right,
displacing their anger from other people onto you
right,
as
right,
well.
right, right. Probably more common.
So maybe you deserved 3% of the anger of their, but you got 100%
Right, right.
directed at you.
Good opportunity for noticing the transference.
Yeah, I've seen it from like the boss example, like guy gets beat up by his boss, comes home and just tears into his wife. It's just really, really nasty displacement. Just awful. Obviously very maladaptive in that sense. Okay, what about reaction formation? Chris, talk to us about reaction formation.
Yeah. Well, reaction formation is when someone is dealing with an emotion unconsciously that might feel threatening to their self-image or to an important relationship, and they turn it into the opposite feeling, right? So probably like a classic example would be um, someone harboring a lot of anger and resentment towards a coworker, right? Kind of undealt with, disavowed underneath the surface. But on the surface, it looks extremely kind, like overly accommodating, right? So almost to the point where it feels fake. I was even thinking about, a recent client that I had, and just when they first came in, they were describing their marriage, right? And it almost seemed too good to be true, right? It's like everything they said about their spouse was everything was perfect, right? And so it put me in a weird position where I'm thinking like something doesn't feel right here, right? So this is like the classic alarm that reaction formation is present when things just feel too good to be true. Sure enough, after about a month or two, this person starts to uncover some deep resentment and anger and rage they had towards their spouse. And so much so that they felt like they wanted a divorce, right? So 3 months difference started with this person's perfect, right? They could do no wrong. 3 months later, it's like, I want to divorce this person, right? Because for the first time, they're uncovering all of this anger that had been sitting under the surface, right? So the reaction formation was from um, idealization, right? So they were hiding the anger with idealization.
Mhm. Yeah. And when it comes out, it can come out very, it can swing the other direction sometimes, right? Where it can go from 100% love to 100% hate.
Thinking about like the way to actually work with someone who is displaying reaction formation is to just give them space, right? So I didn't really have to do much with that client. It was just giving them the space to really open up and figure out what might be underneath uh, the idealization, right? I didn't tell them, right? You have the defensive reaction formation. I noticed it, but kind of let them wrestle with it a bit and kind of guided the sessions to the point where it became clear they didn't feel like they could hold the good feelings they had towards their spouse with the angry feelings they had towards their spouse. So they had to just hang out in the idealization area.
I think also it could be like a momentary thing. Like, so maybe more neurotic oriented person would have like some anger towards their spouse, and instead of, you know, being angry, they would go kind of clean the dishes, right? They would go clean. It's a loving thing to do potentially, and they're doing it in the midst of anger, which is kind of counterintuitive, but that's a reaction formation as well. Um, yeah, any of those simple ones that you guys think of when you think of reaction formation?
Somebody
I
has
always think of like the little kid who's super jealous of their sibling and really wants to shove them, but instead goes to hug them, right? Because it's like unacceptable to shove your little brother or sister.
But sometimes it's not the nicest hug either. Or sometimes it's like too much hug,
The too much hug.
it's like the hug that never ends. Olga, what was your thought?
Hug.
someone who's attracted to this, same sex, sort of like, it's like this classic example, and then kind of like repressing, their own homosexuality, basically. And so that in a way that they oppose it, and sort of like maybe join some kind of like anti, homosexual movement or stuff like that, and kind of like very vocal about, not supporting it, but kind of like deep down they're actually attracted, to, same sex. So I was thinking that that was reaction formation too, like in a very extreme form, I guess.
Mm. Oh, I think about like there's been some public cases of pastors who who
Mhm.
yell vehemently against, homosexuality, and
Right.
then it's like that is the reaction formation against the desire, right?
Mm-hmm.
That is, and the further unconscious these things are, the more dangerous they are, right? So if someone is very unconscious of it, and they're acting out it with very low insight, that's when they can then impulsively go the other direction in a way that could blow up their life, rather than it just be like holding a fantasy and then holding the fantasy of both sides, like, because that person is acting upon it in a way that's very destructive sometimes, if that makes sense.
Mhm.
Mm-hmm.
Yeah, instead of just allowing a feeling to be present, it's like you can't handle that, right? So you have to keep it out of your awareness and allow the opposite to take precedent. Like you're saying, so like homophobia versus saying, I have an attraction to the same sex. It's like you can't admit that, so it turns into homophobic tendencies.
It's like you're undoing it in a way, sort of like, yeah, like extreme, way of undoing it.
Maybe the undoing would be going on X and posting a mean, hateful
Mhm.
tweet,
Yeah.
It was
to show how much you don't align with this
Mm-hmm.
issue.
it was interesting because when I was looking at like undoing and then reaction formation and the distinctions between them, I was reading up on, and I forget where I saw it, but there was a school of thought of like some individuals or some providers think that reaction formation is the first coping mechanism or secondary or first defense, and then when that fails, undoing can become the one that they rely on.
Mm.
And I think like we're gonna just be distinct that this is like unconscious, right? Because if you know that you're putting something out there that is harmful to a person or a group of people, then you know it, and it's no longer this defense, right? Once it's a conscious
Yeah,
action, like you can't just be
yeah,
like, oh, I'm self-hating, or I'm just about this part of myself, because now you're conscious, so you don't get to fall back on kind of like defenses. Your reasoning, like once you know it, you know it.
yeah. Reaction formation is unconscious. So yeah, I don't know. What do you guys think? Would it make sense then? Like if you know you have attraction to the same sex, could that be?
Because once you know and you're doing it, if you're conscious, then I don't think it counts,
Well, maybe you don't hate that part of yourself.
right? It's but if you're now just like kind of bullying other people or punishing other people for how you feel about yourself, and you
then
know
then
this,
then that is acting upon with a hatefulness. Yeah, I agree.
Mm.
Okay, let's keep going. Identification, Amanda.
One of my examples for identification, I was gonna tack on to Chris's reaction formation, because Stockholm syndrome, and I'll get more into the identification with the aggressor, but I was thinking, is that a form of reaction formation?
Stockholm syndrome's complex. I mean, I imagine there's a lot of defenses at play there. There's denial, right?
True.
It is kind of a more psychotically oriented reaction formation. Like there's a lot going on there, right? It's a
Yeah.
complex behavior. Um, so Stockholm syndrome is like if someone was like abused and then goes back to the abuser, right? And so sometimes I've heard this happen, and then the person feels a lot of guilt. Well, why did I do that? I don't understand why I did that. So they're unconsciously driven sometimes back to the abuser. And so it's like, well, why were they driven back to the abuser? And in that way, it's like maybe the hatred towards the abuser turns into love, right? That would be the reaction formation. But I think that there's a lot of other primitive things there too. Dissociation. They could
Mhm.
dissociate um, the the bad memories out. They could deny the bad memories. They could remember only the positive, if there was positive. There could be so there could be like an idealization. You know, like an abusive, sadistic person demands a level of idealization, or the person is very much abused. And so there could be like a forced, kind of like a programmed idealization of the abuser. There could also be fear of death, fear of like something bad is going to happen if I don't, right? So there could be like sometimes abusive people in a way program people to believe that bad things will happen if they ever say anything, or if they ever leave the person, or like. So there's also like going to the most feared object. The most feared object is the object to be worshipped in some people's psychology. So if they feel that the abuser is the most powerful person in the world, type of like belief, it's a belief, right? It becomes a belief out of the trauma, then they could want to join the abuser until like they wake up to that not being reality, not being the case, not being it's so toxic for them that they are psychologically falling apart.
Yeah, I'm thinking of that case. I'm having a brain fart right now. The case years ago with the young girl that was kidnapped by the two. It was like a couple. I'm blanking on her name.
I don't know. I even in the Epstein files, I've heard of this happening in the Epstein files, and so
Yeah.
this is where it gets really convoluted. Like, is this person uh, someone who was abused, or is this person who was helping Epstein now hurt other people? Like, are they helping other Epstein abuse other people consciously, or is it because they were in kind of like a trauma like state where they were fearing for their life? So this is that kind of like complexity.
Mhm.
Jason, you were nodding your head.
Well, I was wondering if you might be referring to, I think it's Smart, like,
Yeah.
well,
Yeah, yeah,
yeah,
yeah.
Natalie Smart, and a documentary was released on it's streaming somewhere right now, recently released, and
Oh, really? Oh.
something that was fascinating about it is they interview her a bunch, and she's on this she's on the presenting circuit. But anyway, I didn't get the impression that Stockholm syndrome actually applied to her, but it was at risk of that happening. And but it's almost like a compartmentalization sort of happened, and this woman like survived disappearing for a couple of months with two abusers who took her from her home, and
Mhm.
she was found, but her identity didn't seem to be super rattled, and my hunch is she got a bunch of good psychotherapy. But it reminds me of turning against the self a little bit
Yeah.
too. Like this,
Yeah.
it is such a complex thing. I
Yeah.
appreciate it where too, like, yeah, if you can't beat the aggressors, like a possible outcome could be like you beat up on yourself instead and you just
Mhm.
become defeated.
Yeah. So many of the defenses are just so intertwined. It's so complex.
Mhm.
Um, but anyways, we kind of went deep into some of identification, but in the most simplest terms, identification is the ability to identify with another person or aspects, traits of another person. And like any other defense, it's an inherently neutral process and it can have positive or negative effects depending on who is the object of identification. So, I think like in mainstream language, we say, I identify with this person that's a mentor, that it's usually in a positive light. But psychoanalytically, we usually think of identification that's more motivated by the the need to avoid anxiety, grief, shame, any of the painful affects, in order to restore that sort of threatened sense of self, and promote self-cohesion and self-esteem. Um, and in Nancy McWilliams' book, she talks about how Freud, um, he was the first one that defined a non-defensive versus a defensive um, identification. So the positive and the negative. Then I'll go into the negative. We kind of did a sneak peek with the Stockholm syndrome. Um, but he basically said there's elements of both, like a straightforward of that taking in what is loved, like you identify um, with your parents, your primary attachment figures initially. And it's very simple, like I want to be like mom or dad, and you want to achieve closeness. And then a more defensive operationalization of that would be um, kind of what Dr. Puder was saying, like I become the feared object. If I become them, their power will be inside me rather than outside me. Um, and so I possess that. Since I'm a child psychiatrist fellow, I'm always thinking developmentally. So I kind of think of identification. I'll explain it chronologically through the lifespan. So, like I was saying, um, first identifications when you're a child with your primary attachment figures, and you kind of become like this hybrid person, kind of taking little bits of people that you like mentors um, it, throughout your life. And so it becomes kind of like a nuanced mosaic person that you become, is how I um, think about it. And it positively, if you think about it, it's the basis of empathy, being able to identify with others. Um, and Nancy McWilliams gives the biggest example of therapy. So um, the propensity of the patient and to identify with the therapist is what is the magic secret sauce in therapy, and having that reparative relationship with the therapist. So those are the positive examples. I'll go into the kind of Stockholm syndrome we were talking about. So that is what Anna Freud first described as identification with the aggressor. And I never understood that term until this class. I had heard it and then it finally stuck. So that's kind of the defensive identification, where you identify with the bully, the aggressor. You consume them, you become them, you take it inside, you internalize that representation of them, become them. And so, like an example is like the child abuse, like parent abuses kid, kid goes and bullies kids at school, and then grows up and becomes and then abuses their kids subsequently. So it's the mechanism of which like intergenerational abuse continues.
Which I'm actually doing an episode on kids that were sexually abused and the rates of future sexual abuse. And it's like it can be as low as like 3% in some studies. So, you know, it could also be abuse could also be stemming more from other personality pathology that's unrelated,
Mhm.
like sadism and psychopathy and, stuff like that.
They were talking about psychopathy, how I I think it was I read somewhere where it's like a failure of identification, or you don't identify with the values of society or something, and then that's kind of a trait of that
Mm,
psychopathic personality.
right. The people they maybe look up to are the least savory people. But identification with the aggressor, I'm so glad that you figured that one out.
I know it was
Very,
like,
very helpful.
ooh, yeah.
Adopt and imitate,
Mhm.
internalize aspects of the aggressor, adopt parts of them like the bad things that they're doing. They see themselves as either doing the bad things in fantasies of their mind or in actuality, right? Or like I am the abusive person.
I feel like you see it a lot in therapy with, um, somebody who's maybe grown up in a very critical environment, and the person goes and really internalize that aggression. And then what you see in practice is somebody who's always feeling guilty about anything, and always kind of really hard on themselves, criticizing themselves. And I'm thinking a lot of times it's a real identification of the aggressor. They've really sort of internalized that critical voice, and they're constantly putting themselves down, making themselves sort of pay.
Katya, amazing. Yeah, very good.
Yeah, because it was adaptive when they were younger, or necessary for them to survive. Yeah.
Hmm. Totally adaptive.
Yeah.
And it's actually adaptive even as adults, right? Because people who are following the rules and doing everything right are generally widely beloved, right? But they suffer internally.
Mhm. Good point.
You'll see
Yeah.
this sometimes, like I've read some stories of true crime, like you'll get like someone who's doing a lot of criminal activity at a very young age, 17, 18, 19, and their dad was a con artist, and so they were watching their dad do this their whole childhood, right? They're sort of absorbing that, they identify with it, they go on in that criminal sort of behavior, criminal acts, right? Um, s- you can see it in cults. I think, Amanda, are you going to talk about that at all?
Hmm. Oh yeah, cult. So that's a big example that Nancy McWilliams adds. How others I kind of spoke about, this defense is used to kind of build that self-cohesion, that ego identity. And so people that are more like easily influenced by others, or have some like identity confusion, are
Hmm.
more prone to joining cults. And go yeah, going back to kids, like from an Ericksonian perspective, like that time when their adolescence is when they're developing their identities and their ego identity. And so um, adolescents are really impressionable um, in that regard.
Yeah, it's like people with the identity diffusion,
Mm.
they're like almost like stem cells if they're put in a good environment, they may adopt a lot of that good. If they're put in with like some very abusive person, they could become the counterpart of that abusiveness. And so like in pop culture, you hear like some very narcissistic, grandiose personas online. It'll be like, oh yeah, I like to date girls when they're like super young and blah blah blah, right? Like, and they'll they'll say so I can mold them how I want them to be, and that like, and they have a track record of a wake of destruction behind them interpersonally, right? So it's like it's cringe for me because I'm like, yeah, and then I'm going to be this therapist trying to put put these people back together, you know, or like training therapists that are putting these people back together. So, yeah, the identification is dangerous, right? When you're young, when you're impressionable. And I think talking about it, putting it out there, developing a knowledge of it gives us power, right? Think twice when we think about who we want to consume, who we want to kind of like allow into our brain waves, right?
One thing I wanted to ask everyone is the difference between introjection versus identification. I couldn't, Nancy kind of mentions it in the book, but I can't figure out the nuance difference. I think she described introjection as like the precursor to identification, but it sounded similar to me, like introjecting, like taking internal representations of others when you're younger, kind of consuming that. So are they interchangeable?
No idea.
Is it a matter of degree?
I have no idea. I went down a rabbit hole and I could on the internet. I could not find it or a good, satisfying explanation for it.
So the way that I see it is that introjection is a much more primitive version in which you swallow whole all of the things of the other person, their ideas, attitudes, judgments, standards, values, all of them. You treat it as if it's your own reality, your own voice, your own values. I think the identification, you adopt portions, right?
Yeah.
Becoming like I have a lot of identification with Dr. Tar. I differed in some things, right? If I was maybe more primitively oriented, I would introject and I would almost sound like Dr. Tar in all of my answers. You know, instead, I take in little pieces from different mentors throughout my life, right? I interject. And identification. I have identification with various mentors, and that's a good thing.
Yeah,
Some mentors I know in person, some I don't know in person.
That's a really good example of like what it looks like from a healthy perspective and from an unhealthy, dysfunctional perspective. It's like when people become almost the other person, like you said, like their tone of voice, everything. That's the defense.
Also, like I think introjection, you end up with a lot of these like shoulds, right? And it's like a super ego structure. So, for example, if you had a strong interjection of Jonathan Shedler, anytime you broke the frame, you would be crippled with guilt for days, right? Because you've gone against your favorite interjection guru. Whereas there's like you know, the good side would be to adopt a lot of the good and to appreciate the good from different people and different styles, right? So when I would watch video of residents, I never expected them to have the same verbiage, the same style as me. I wanted them to have empathy. I wanted them to have, you know, but for different people that looks differently.
For some reason, it came to my mind. I don't know if you know Josh Shapiro, who's like governor of Pennsylvania, who sounds and acts just like Obama. You know, he's
Oh,
like literally used
okay.
the same, like, you know,
Yeah.
phrases, just like Obama. You know,
Uh,
it's like, so definitely kind of interjecting a lot of Obama. You
and then
know,
sometimes I think to myself, what's going on with America? And I pause like this every couple seconds, you know, and if you do that, you know how to capture someone's attention. You string words together just the right way. We're not blue states or red states. We're the United States.
That's
You know?
really good.
That's good.
I haven't practiced that, so I'll practice it.
That's impressive.
We could do a role play. I'll be Obama.
Yeah.
You be a therapist who's pretending to be, yeah, okay. Uh, yeah, it's like it's hard to know. Like, okay, does this guy just love Obama? And he's like, listen to Obama on repeat, hundreds and hundreds of hours, right?
And we all
Okay.
probably start to sound like you eventually. Like we've heard hundreds of hours with David Puder.
No. Because you're not you have some identification. You don't have the full interjection. I have some therapy clients who I've seen like twice a week for years and years and years. Some of them are therapists, and they've pulled in a lot of the good, but they have their own style. You know, they have their own life trajectory, experiences. They have their own populations they like working with, and that's great. So
That is great.
sublimation, Lital.
Okay. I actually want to take a pause because we're doing mature defenses, and I want to recognize that these drives, these negative self states that we can see without any distortion. So we're working on them or trying to work through them, but we're doing it clearly. So different than some of the examples, we can be totally aware with mature defenses, and sublimation falls into that category. Consciousness. And so now that I'm fully mature, I want to start with an illustration of a guy we all think of as like really well put together. And I wanted to just start with Batman. For those of you who don't know who Batman is, he's a superhero without any superpowers living in the city of Gotham, which is in comic book land. And he has a really traumatic childhood where he witnessed his parents being murdered, right? And right there, we feel his helplessness. He feels helplessness, lack of control. As that develops, you can imagine rage building with this guy. We can imagine like a desire for vengeance totally brewing with that kind of loss and that kind of circumstance. And rather than identifying with the aggressor or totally falling apart with this loss, he's able to sublimate it, right? He's able to take it and focus it into something that is ultimately considered to be pro-social, and that is taking out bad guys. So the lack of control, he is so regimented about these workouts. If you ever see a Batman movie, this guy's working out no matter whose adaptation. He is all about the science, has to have the best tools, the best weapons, costumes, whatever it is. He wants to make sure he is not going to let this happen again. And that rage also comes out. We see him throwing guys through brick walls. We see him destroying lots of Gotham City. But the thing behind it is to try to make the city better and life safer for people. Like that is the sublimation aspect of it. And that really connects to what Freud saw about this defense, is that it can actually bring civilization forward, not just the individual forward. So it's not unique to Batman to feel rage, to feel that the world around you needs to be put in order. And Freud kind of credits sublimation with a lot of government, with religion. Like these are ways that people have taken these similar feelings and not just moved themselves, but moved everyone around them forward. And I kind of want to go back to, like, I picked Batman because we can see him in a black and white world. Like in his representation, none of these bad guys have their own trauma history. They are all just like bad guys. Like no one had absent parents. No one is like hungry and doing crime for that reason. Like we can just see it as moving society forward. We don't have to see it complex. That was my example thinking. And so we are transforming like potentially very harmful, potentially very devastating drives into something that is progressive.
Yeah, like dancing, sexual tension, right? And a young person becomes dancing, something like that.
Right. And I think like the classic examples are always like you have this desire to hurt and you become a surgeon or a dentist. Like that's usually what we see in like the board review books. We see that come up a lot, right? And that's
it's kind of dark. Not everyone who wants to become a surgeon does that.
not everyone. No.
But I love your example of Bruce Wayne and Batman. That's such a good example. It's such a good example of like turning that like anger into like I'm going to make the world a better place. I'm going to fight for justice.
That's connected to because his parents, I didn't know that part, by the way, that died from the criminals, right? So he's kind of like trying to, yeah, and undo that a little bit in a way.
Yeah, there was some
Yeah.
undoing in there. There's a ton of defenses and that go through.
I think of like some groups like there's a support group that of mothers who have lost kids to overdose with drugs, and then they unite to develop a support group for other parents who lose their kids. That feels like a really good example of sublimation too, of taking, you know, that grief and loss and anger and then turning it into something that can help to breed
Right.
support and healing
Right.
for other
Yeah.
people.
That's wonderful. Or like
And you-
someone who's had a bad childhood and knows what it's like to suffer as a child will go in and become a child psychiatrist to try to help other people. Or that become a researcher to solve, you know, maybe their mother died of cancer. They'll go become a researcher and spend their life trying to solve that specific type of cancer. These are like the world is a better place for this. And actually, sometimes with patients, I'll kind of try to encourage a good sublimation. Viktor Frankl wouldn't see it fully as a defense. He would see it as actually like the path of meaning and meaningfulness.
It seems like it ties into reflective function, right? Like, why are we doing what we're doing?
I think a lot of us told our
Yeah.
stories of why we're doing what we're doing, and a lot of it had to do with for good reason, right? A sublimation of sorts.
If we're doing well, we can identify this in ourselves in some way.
Yeah, absolutely. And also humor, right? Tell us about humor.
So tempted to come on here with a Batman mask, but I just didn't.
That's awesome.
Disappointed.
That would have been humorous.
Just to know if you could pull it off, you know?
I've just gotten into like I just bought some Batman comic book like it was just like omnibuses. I never knew like you could like go back and research different like decades and then they like package them all together. It's like amazing.
Wow. Right. I think humor is more Spider-Man though, like, and that's like both in crime fighting and talking to girls. Like if we remember Spider-Man, he's always like nervously telling a joke and it's to lessen the tension. It's not to avoid it, but it is so he can move forward, right? Going back to back superhero, but there's this movie called The Avengers where he meets all the other superheroes and he's like this high school kid, like brand new to his powers, and he just doesn't have that like experience. And so they're all introducing themselves and he said, oh, like we're using our made up names, like I'm Spider-Man, right? So he just tells a joke to lessen his nervousness and his anxiety, but he can do it, right? He can still stand up with all these bigger guys and show up. So yeah, humor lessens the feeling and allows us to move forward. I actually wanted to give a personal example as opposed to a patient example. I was recently at a memorial for a friend who passed. And it was just like, I couldn't even imagine like starting to speak. I was like frozen, just like overwhelmed with grief and sadness. And it was my turn. And I went to telling a humorous story, right? Like this was a very straight-laced dude. And I shared about a moment where we like jumped a fence in Costa Rica to like explore some river, as a contrast to like his very Batman regimented style. And like everyone laughed and like allowed me to have my walls come down and allowed me to actually face the stress and face the sadness that I was feeling. And that was like me using humor.
So good.
Yeah. And then like I heard this quote the other day and I wrote it down so I didn't get it wrong. Like, I don't know if you guys have heard of Victor Burge. he was like a composer. But his line is like, laughter is the closest line between two people. And I think like that reflects like in that moment, like that allowed me to transform the distance from anyone else in the room. And it also is like a good line to myself. Like if I know I'm just like cracking a joke in the setting, sometimes it is because of nervousness or sadness and allows me to come into it. So laughter is like this great like step into like confronting or seeing other emotions and working through them and facing them. If you want the board review example, it's somebody coming to their primary care doctor's office with like erectile dysfunction and like cracking a sex joke to break the ice. So I'm giving you the textbook example as well.
I love the idea that the only one who could speak truth to a king is the comic, right? So you have like this, the jester is the only truth teller of the king. Everyone else is a sycophant. Everyone else is telling the king exactly what the king wants to know. And then the jester comes up and says what everyone else is feeling or thinking. And then it's just like, it's funny, so it works. He can get away with it, right? He can get away with saying things that no one else can say.
It's like this truth telling that can happen to humor that like even brings down the other person's guard, right? Like not only is his guard down, everyone else in the room and like the person hearing it.
And you can think about how much like humor is based on forbidden impulses, wishes, right? And it's kind of like that. Or even sarcasm. Sarcasm can be like a sense of humor, but it can also carry a little bit of truth.
I'm thinking about specific comedians, Latal. Two people that keep coming to mind is Chris Farley. I don't know if you're familiar
Yeah.
with. And I think about like the self-deprecating. I mean, he was hilarious, but you think about it from this point of view, it's like very maladaptive. But then I think about someone like Bill Burr. Do you know who that is?
That I don't know.
He's more like he's more like higher RF. He's like in touch with his own humor and how he covers up things with his humor. And there's actually a different type of funny, I feel like, that comes along with that, where it's less maladaptive. Um, I don't know. Do you guys are you guys familiar with Bill Burr at all, or
Yeah,
comedians like
he's
him?
kind of, yeah, straightforward and kind of like rude. You know?
He's
So,
got like
Yeah, but
loud
he knows
voice.
it.
Yeah.
Yeah.
yeah, yeah,
Uh,
yeah.
Boston. He's got the Boston accent.
Yeah.
Yeah.
I actually
Yeah.
love him. I think he's great. Yeah,
Mhm.
yeah.
I do too.
I was thinking of Conan O'Brien was on the podcast with like Jason Bateman, and
Mm.
his parents had died. Both parents died like in the last year, and he just went and told this elaborate funny joke about how Bateman had killed his parents, and it was you could just see that was his way of dealing with the uncomfortableness of that story. It was
Uh,
pretty funny.
yeah, I heard that one, and yeah, he and all his friends went along with it because
Right,
they
right,
knew that
right.
he was dealing with it in this way. Yeah.
I also think humor can be really useful in really stressful situations. Like I have a number of combat veteran friends who talk about when they were under fire, um, humor, they would crack jokes and that helped them diffuse the stress and just stay focused on what they needed to do. Or when I used to work in ICU, sometimes situations would get really stressful or tense or sad or whatever. A few jokes really helped to kind of just lighten the mood so that you could carry on and do what you needed to do.
Yeah, sometimes therapists can have some dark humor, and I try not to do any patient-directed humor on this podcast, or in real life. I don't think Chris has heard me do too much patient-directed humor, just because like it's better just to get in touch with the real emotions underneath, and process them. So humor, okay, and we got one more reversal, Amanda.
So reversal is it's a really interesting one. So base basically what happens is you transform a passive position into an active position. So from switching passive to active, like victim to victimizer, you basically shift the power aspects of a transaction with another object that you're interacting with to in order to deal with that sort of psychological threat in your situation. So the example, I'm always going to give the therapy example since it's relevant for us as therapists, but Nancy McWilliams gave the example of how therapists are uncomfortable. Not all therapists, but a lot of therapists are uncomfortable with their own dependency needs, and they actually yearn to be cared for, and they vicariously are cared for through the care that they provide to their patients. Um, and so they unconsciously identify with that person's gratification. So that's the more adaptive version. Um, altruism is a good simple example. The more maladaptive examples is like fraternity hazing or like any hazing, abusive rites of passage, like where you are switching from that passive position, getting hazed, and then when you're the upperclassman, being in the active transformation, but with that own or with that soul transformation, the affect around it changes. You're more, it's a more positive um thing. And I was actually thinking about that example. I was like, oh yeah, I remember getting hazed in sports when I was younger. And it was the worst thing when you're going through it. But then the next year you're like, oh yeah, uh, this is so awesome. And I'm like, whoa, okay, I haven't even thought about that until I had to do reversal for the podcast. Um but yeah, repressed memory unlocked. And so I understand reversal now.
It could also be positive, like you're being taught and then you become the teacher.
I think you see it sometimes in sports, um, where someone's extremely nervous, but they don't seem that way. They push through, they become overly confident, and sometimes I think they actually might be better in that fearful state.
Or kind of going back to Little's sublimation, doing that positive switch, you know, um, from a more like helpless position, a powerless position to a more and using that pain to go to a more powerful position, like how you were given the example, Dr. Peter, where people go into medicine because of that reason and
Hmm.
what they experience when they were younger.
Yeah, so maybe when they were a child, they were abused, they felt powerless. Now they're having a reversal where they are powerfully helping someone overcome it. So they're in a position of power in the therapy office, helping someone through the trauma that they themselves, got through. This is a really wonderful, wonderful ripple effect of positivity, right? It's like we need more of that. So yeah, that's where I kind of get into this is no longer almost, it's not a defense mechanism. It's not like there's something underneath it that's better, right?
Mhm.
It is the good. Um, Now, if they maybe were working 100 hours a week and couldn't stop and like, you know, crossing boundaries with patients, like maybe that would be a place of like necessary supervision or some direction outside of that, where they can live life and not feel in a compulsory position to always help, right?
I, I don't know if this is another example of reversal, but I think of people who have survived food insecurity or an eating disorder who grow up to become a chef or a dietitian. And, there's a therapist component, but there's also even the dependency for food that that of course you have, and to reverse that hunger into literally feeding somebody
Hmm.
else.
Yeah. Or you'll see like someone who's very high in disgust, high in order, go into infectious disease and they're fighting off the disgust and the putridness of bacteria and viruses and you know they
Huh.
infectious disease doctors always have the longest most detailed notes, right? It's part of orderliness. um yeah, that's a good example, Katya.
Wonder if this might apply. It might be a stretch, but I saw someone present recently who was a fabulous speaker in front of others. And they spoke about their nervousness and anxiety with public speaking. And I'm thinking of performers who can experience, I imagine a number do not, maybe not everybody, but a number have a lot of anxiety and just psychological tension, and then you head out onto the stage and it's like an escape, maybe there's some euphoria that comes with it, but like is there a way that could apply here?
Yeah, I think they're mastering that fear, right? And they're switching from a place of you know, weakness or fear into strength and
Yeah.
like success. And I think that can feel very gratifying. All right, guys. Well, I think that is where we will end.